Hello, my name's Ashley Rees. I am a consultant paediatrician at Watford General Hospital and Hemel Hempstead General Hospitals, part of West Hertfordshire Hospitals NHS Trust. And I'm also the Associate Medical Director for Education and Training and the Director of Medical Education. And I'm presenting to you a slide set that talks about our ambition to change our name as an organisation to become the West Hertfordshire Teaching Hospitals NHS Trust. Now, this presentation has three parts. We're going to talk about what teaching hospital status is, give a bit of background and context. I'm then going to talk about why this is something that we as a trust, as an organisation, want to do. And then I'm going to talk about the process, how we do it, and what we need from you. So just for a bit of background, this is a quote from the University Hospital Association document, which explains how a trust goes about changing their name to include teaching in its title. And it says that having teaching status denotes the institution as important in national teaching and research and helps it recruit and retain staff. And there is no doubt for us that this will confer us some great advantage. The document details the specific requirements of applying to change the trust name to include teaching, which is what we want to do. And in so doing, the establishment order of the trust, which is the Act of Parliament that defines an NHS trust's name, will be changed, and that application goes to the Department of Health, and then they review it and make that recommendation, and there's legal process that ensues from that. Now, in the past, the Trust has worked quite hard and has had a relationship with University College London in getting the denotion of associated university NHS provider. Now, this is something that was given to the Trust about 13 years ago. It's not something necessarily that made itself into the popular culture and fabric of the Trust day by day, but it was something that a team in the Medical Education Centre worked quite hard at getting, and it is now a legacy title and isn't something that is available anymore or something that is given out. You'll notice that there are NHS trusts that have called themselves University Hospital, and this was because the document that I showed you about changing a trust name and including university or teaching in the title from the University Hospital Association on the previous slide, the rules have changed and time has moved on now, and it seems that that tag is reserved for those trusts that are in large cities attached to large university institutions with medical schools. And those hospitals used to be known as teaching hospitals as a shorthand for being very much attached to the university and the medical school. So for West Hertfordshire Hospitals, as a big district general hospital with an identity of its own and doing important work in teaching and training, not only doctors, but other healthcare professionals as well, it seems right that we should include teaching in our title to make that statement much more obvious to everybody, both inside and outside the organisation. So the reasons to do this more specifically come down to our values in the Trust of commitment, care and quality. And giving great care is absolutely the first and foremost business that we are in, and that should overlay everything about this work. So this project is true to our values. It helps us progress and develop ourselves. It gives us something to continue to aspire to, standards to maintain and uphold. And we consider West Herts a great place to work, and it's also a great place to train and be treated in, of course. And as we redevelop ourselves in the current situation around 2021, making plans to build a new hospital, it's a good time to change our name and include teaching in our title. There are a number of important institutions that we have very important connections with, and some of these institutions we've had connections with in various forms for quite a number of years. I've already mentioned the medical students from University College London, from UCL, who've been with us for well over 20 years, and over time we've had arrangements with other universities in the area as well from a medical student perspective. But we also have a relationship with St George's University in Grenada. They're an overseas medical school, and we have a significant cohort of medical students that come into the trust for clinical training every year, and they come to others and other district general hospitals across the UK for clinical attachments. We have a strong commitment to train consultants and specialists of the future. So we have a very significant training program for doctors in their foundation years and also in other specialties and in specialist training, and those doctors are overseen by Health Education England, with whom we have very close relationships. Many of the curricula that are described for those specialty doctors working in the medical and surgical specialties are described by the Royal Colleges of the various medical specialties, and the Academy of Medical Royal Colleges oversees them. So there are relationships there, and every specialty has a college tutor that supports that training program. And of course, we have many midwives, nurses, and other healthcare professionals coming to spend time with us, some working shifts and some in more obvious learning and apprenticeship roles from University of Hertfordshire and other universities locally as well. But UOH is another very close ally that we have in our education and training work. So how do we change our name to become known as the West Hertfordshire Teaching Hospitals? Well, the first thing we need to do is gain support from our University Medical School, and that is something that has happened already. And the Dean of UCL has indicated her support to us in this project. There is in the University Hospital Association document that I showed you earlier on an Annex A that details a list, really a checklist of what we need to demonstrate to show we have a significant teaching commitment. And that is something that we can, some of which we do already very much, much of which we can put in place. And those are the very specific aspects of having learners in the institution that we need to uphold. Things like educational supervision, the physical area being appropriate for learners, space for the learners to leave their personal belongings, and space to be able to teach the learners. Those are things that we generally have in place, and the Annex A is more or less taken care of. What we also need to do is demonstrate our significant teaching commitment. And that is a large piece of work that will take form of a showcase document detailing all the great work in education, training and learning that we do in the trust. And in order to demonstrate that, we have to do the third level there, which is a stakeholder engagement plan, which involves inward and outward engagement with the members of the organisation, the employees, people working in the trust, but also local NHS organisations, local trusts, our patient groups, and that is a big piece of work. So 3 and 4 there are linked together. And then we make a submission to the Health Secretary at the Department for Health and Social Care, and then they consider that, and if they agree that we've demonstrated our significant teaching commitment, they will put forward a recommendation to change the trust's establishment order, which defines what a trust is called. That will be heard in Parliament, and then we will be able to say that we can change our name. So at this point, we're asking for support. We want to inform you what we're doing. We need support from all our key stakeholders. We want to take everybody involved in the hospital, particularly the staff and the patients, on this journey with us. And if you have any thoughts, comments, queries or questions, we'd be very, very happy to answer those. So we look forward to moving ourselves towards being known as a teaching hospital, to waving a flag for teaching, learning and education, all the activities around teaching that we do day in, day out here in the organisation, to become known as West Hertfordshire Teaching Hospitals NHS Trust. Thank you very much.